So, good afternoon. I thank KSOS for this opportunity. So, in this room, we are all united by one single thing, our love of ophthalmology. So, that's why you should be... Is it okay now? Yeah. In this room, we are all united by one single thing, that is our love of ophthalmology. So, that's why that statutory warning is very important. And this talk will be about defining the problem of work-related musculoskeletal diseases in ophthalmologists. Let's analyze it, explore the ergonomic solutions, and empower ourselves to act upon it from Monday. So, doctors often take better care of their cars than they do of themselves. Don't you agree? So, that's why being a busy ophthalmologist in itself can be a pain in the neck, especially by evening, because if you want to work well, you cannot avoid bad posturing. You cannot avoid repeating it over and over again. So that's why we get all these back pains, neck pains, arm, shoulder pains, etc. In fact, just see this. If you support the arm also, there is a problem. If you don't support it, so there is a problem. So the question is whether to support or not to support. So don't think this is very rare. These are the stats, and India 71% of ophthalmologists are having these issues. So that is why the AAO made a task force for this problem in 2015. I urge all of you to visit this site and take this course. There is a course, online course, which will do a lot of good. So let's see what this is actually about. The ergonomics means it's a process of designing and arranging workplaces, products, and systems to suit the professionals, in this case we, the ophthalmologists, because one size does not fit all. So what is the goal? The goal is to have always your spine straight and the knees at right angles, thighs parallel to the floor, feet flat. Yes, this is very easily said than done. How exactly to do this? And it has to be done everywhere. So start with the space, go on to the furniture, make sure that your tools and your equipments are, ergonomically fit, and also, most importantly, become aware of this problem, as you will be now, and turn it into your attitude and adopt it into your practice. So let's start with the clinic. So we all these days have to turn our head towards the patient, the bystander, the system. The patient, the bystander, the system. So please arrange your layout such that the strain on your, torsion on the neck is minimum. And regarding the seating, we are used to these type of rotating stools. It is time that we changed. We should have chairs like this. I have actually introduced them in my department with no armrests, curved chairs, which are actually having the backrest at the lower back. And don't forget to use your progressives at work. This is the classical praying mantis position. You can see how I am sitting. This is the way I usually sit before this talk happened. So we are always slouching in the slit lamp. We are extending our neck. We are bending our spine, and this is how the outline looks. So what should we do? We should be doing this. Before each patient, adjust your chair such that the eye of the patient, the eye of the examiner is at level, and try to consciously adopt the ergonomic position so that, it can be slightly straight like the other picture, next picture. So this applies, and don't be hard on your arm and the hand. Don't rest it unnecessarily on hard surfaces. And these principles apply to the OP, the clinic, and the OT. Indirect ophthalmoscopy is very bad for the neck and the spine. And remember that although your rechargeable indirect ophthalmoscope is convenient, it is heavier. Always adjust the patient, make them move, make them bend, make them, do whatever, because they need to do it only one time. You have to do it over and over again, 24/7. So, and whenever, if it's just for a diabetic retinopathy screening, for example, you need only a screening indirect ophthalmoscopy, though some articles differ. You should use your common sense when you should make the patient lie down and do a complete indirect. In the OT, please do an ergo check before you start every surgery. ഓരോ പേഷ്യൻറ്റിനെ കിടത്തുന്നതിന് മുമ്പ്, because you cannot do that in the middle of your surgery. And I just wanted to show you this chair. I haven't used it, but they say this is the best type of chair to have in an OT. It's called a straddle chair, and it gives you very good lumbar support. And the microscope, just one thing, your oculars should be adjustable, and make sure your oculars and objectives have a angle of 20 to 30 degree with each other. And if you're doing a lid repair, better to do in a microscope rather than under the loop. And headset surgery, the industry has come up with it. It is very good ergonomically. I don't know about the economics, and many patients, many surgeons are not very comfortable with it also. So in short, the do's and the don'ts are: avoid, that is, don't unduly do neck flexion, bending of the back. This you have to be consciously avoiding, and always move the patient, adjust the couch or the chair, and relax, because we are always focusing our fine muscles. So it builds up a lot of tension by the end of the day. And relax, and always invest in ergonomic chairs, because you should have the vision that ergonomics is more important than economics in the long term. So if you have red flags in spite of doing all this at the end of the day, that is mobility restriction especially, don't ignore, don't self-treat, go to a physiotherapist. They can help you, but exclude structural problems by going to an orthopedic or a surgeon. Don't shy away from whatever treatment is being advised. We are experts in doing that. Don't do it. So these are certain myths. The youngsters, ഇവിടെയുള്ള യങ്സ്റ്റേഴ്സ് പറയാം, അത് ഓൾഡീസിനുള്ള ടോക്കാണ്, നമ്മൾ ചുമ്മാ ഇവിടെ ഇരിക്കുന്നതേ ഉള്ളൂ. അങ്ങനല്ല. AO specifically says under 40 ophthalmologists should be taking care of this more. And ചിലർ പറയാം കുഴപ്പമില്ല, നമ്മൾ 2-3 സർജറി ഒക്കെ ചെയ്യുന്നുള്ളൂ, അത് കുഴപ്പമില്ല. അതൊക്കെ കുഴപ്പമുണ്ട്. ഓൺലി തിങ് ഇസ് ദ ഹൈ വോളിയം സർജൻസ് വിൽ ഗെറ്റ് ഇറ്റ് ഫസ്റ്റ്. Then I can say that OT is a more risky play. ജിജിക്കാണ് കിട്ടുക, എനിക്ക് കുഴപ്പമില്ല, ഞാൻ റെറ്റിനെയാണ്. പക്ഷെ അത് കുഴപ്പമില്ല, അങ്ങനെയല്ല. എവറിവെയർ ദർ ഇസ് റിസ്ക്. എക്സസൈസ്, ഐ ഡു എക്സസൈസ് റെഗുലർലി, നോ യൂസ്. യു ഷുഡ് ഡു കസ്റ്റം എക്സസൈസ്. യു ഷുഡ് നോ വാട്ട് എക്സസൈസ് ടു ഡു, ദെൻ ഓൺലി. പിന്നെ വയസ്സായില്ലേ, ഇനിയിപ്പോൾ എന്താണ്? No, the 60s is the new 40s. So you have to pamper yourself, and you know, whenever treatment is suggested, you should go for it. We adjust our bodies and everything to the design of the machine we use, when in fact it should be the other way around. So if you need something, why don't you ask for it? It is for us to understand and point out what is wrong in our designs. നമ്മുടെ സ്ലിറ്റ് ലാമ്പ്, നമ്മുടെ മൈക്രോസ്കോപ്പ് എവിടെ ഇരിക്കുന്നത്, അതിൻ്റെ കൺട്രോൾസ് ഒക്കെ ഇവിടെ ഇരിക്കുന്നത്. Why it is not being placed at the level of our belly button, so that we don't have to, unnecessarily strain our arms? Why is it that the phaco foot pedal is here and the microscope foot pedal is here? Why is it that our heels have to be turned up every time we use the foot pedal? We should have flat profile foot pedals. So all this, who will say? You should be part of the solution. The youngsters especially, you should be providing inputs to the industry for ergonomic designs, and encourage and consciously create a market. The entrepreneurs, please hear, ultimately demand drives supply. So in short, practice please what we have preached today, and add life to your years, not years to your life. And fight this MSD with ergonomic practices, prophylactic stretch exercises, and timely medical attention. And finally, ophthalmologists should work with the industry. Your problems are your own, and you should find a solution. You should take the initiative for that. Thank you very much for your kind attention.
Thank you very much, Dr. Lathika, for that excellent talk on practical tips in our day-to-day practice in ophthalmology. I myself have started sitting straight now, and I hope all of you would also too, so as to avoid, so that we can sleep peacefully at night.